Okay. CT imaging by Shannon Brumbaugh. Abstract. Objective: to have a better understanding and knowledge of the processes and the purpose of medical CT imaging. Methods: we use many different medical and other informative articles found on the internet to explore the history of CT imaging and current ways it is used in the medical field. Results: gain a new knowledge of CT imaging and how it is used in the medical field to help patients. Introduction. Computed tomography is one of the most important and useful techniques in radio imaging. Although it has not been around for very long, it has definitely made a useful impact on the medical imaging. The first CT image scanner was successfully used in the city of London in 1971. Engineer Godfrey Housefield was the person who came up with and developed the CT scanner completely on his own. Radiologist James Ambrose was the first health professional to use and test the CT scanner. After scanning a 51-year-old patient's head, both Housefield and Ambrose started jumping up and down due to the excitement at the fact that they just created a new type of X-ray image. In the article History of CT, written by Ingo Zinger, it states, a radiologist and an engineer found themselves jumping up and down for joy, and one of them later called, like football players who had just scored a winning goal. In their hands, the two researchers were holding a complete new type of X-ray image, known as the tomography, that depicted a human brain in unprecedented quality. Indeed, looking at the image, the radiologist James Ambrose could see his 41-year-old patient's brain, a great deal more detailed than they expected, and could clearly make out the cortex, the spaces filled with the cerebrum spinal fluid, and even the white matter. Methods. CT imaging is used to help identify and diagnose various types of tumors. It also helps to find out if patients have internal bleeding, injuries, or other damages. CT imaging uses X-ray beams to move around the patient's body in a circular motion. This allows for different angles of the same structure or organ to be scanned. All the different angles allow there to be more in-depth and detailed scan. The information for the X-ray is sent to the computer that interprets the information, and after it is done, it creates a 3D image or scan on the monitor. In the article, Computed Tomography Scan, found on the website hawkinsmedicine.org, it does an amazing job explaining how CT imaging works. In CT, the X-ray beam moves in a circle around the body. This allows many different views of the same organ or structure and provides much greater detail. The X-ray information is sent to a computer that interprets the X-ray data and displays it in two-dimensional form on a monitor. Newer technology and computer software makes three-dimensional images possible. People who come in for a CT scan are usually there to find out if they have some sort of tumor, internal bleeding, traumatic injury, or cancer. Though CT imaging can be scanned most of the body, it is also used to identify bone fractures in patients as well. In the article, CT Scan by the Mayo Clinic staff, it states, your healthcare professional may suggest a CT scan for many different reasons. For instance, a CT scan can help with watching the process of a disease condition such as cancer, heart disease, lung nodules, a liver masses, and watch how certain treatments such as cancer treatments work, Find injuries and bleeding inside the body that can happen after trauma. As you can see, CT imaging is used for many different purposes. In order to become a CT technologist, you have to meet certain requirements. In the article, How to Become a CT Scan Technologist, a complete guide by Badisha Daya, it gives a clear description on all the requirements needed. Earn an associate's degree in radiography, diagnostic medical sonography, or nuclear medicine technology. Pursue certification through the ARRT in radiographic nuclear medicine technology or radiation therapy. The ARRT requires you have this initial certification before you can earn a CT credential. To become certified in one of these areas, you can submit an application and pass an examination in your chosen discipline. Once you've earned the initial certification, you can meet additional requirements to earn a CT credential through ARRT. The organization requires you to complete 16 hours of structured education within the last 2 years to be eligible for the certification. The exam includes 165 questions related to patient care, safety, image production, and procedures. In some states, earning a CT certification means you're qualified to perform computed tomography scans. Other states require you to have a license, which may involve proving your credentials or taking additional exams. Each year, there are millions of people who need to get a CT scan. Over 80 million CT scans are performed in the United States each year. Something that is new and has changed the quality of the image of computed tomography is photon counting detectors. In the article, Photon Counting CT Systems, a technical review of current clinical possibilities written by Joel Griffer, it goes on to explain the most recent major innovation has been the development of photon counting detectors. By comparison with the energy integrating detectors traditionally used in CT, these detectors often offer better dose efficiency, eliminate electric noise, improve spatial resolution, and have internestic spectacle sensitivity. These detectors also allow the energy of each photon to be counted, thus improving the sampling of the X-ray spectrum in multiple energy bands to better distinguish before photoelectric and competent attenuation coefficients, resulting in better spectacle imaging in specific colors, K-edge images. The new improvement of CT imaging will also allow doctors to be able to have a clear image to interpret and find out what the issue is inside the patient. Discussion. Currently, CT imaging is used to scan parts all over the body and create a clear and detailed image, which helps doctors to be able to correctly diagnose a patient. CT scans have been performed to help diagnose tumors, investigate internal bleeding, or check if there's any internal injuries or damage. CT can also be used for a tissue or fluid biopsy. The relevance of CT imaging is very important to the patient. CT imaging allows the patient to find out whether or not something is medically serious or going on inside their body. It also may allow the patient to find out what's going on without having to go through surgery. There are many different possible reasons the patient might be coming in to get a CT scan, but without a doubt, after the scan is over, the doctor and the patient will have a better understanding on what might be going on. Without having a machine that can use X-ray beams and rotate around a patient's body, we would not be able to diagnose and get the help with many different patients and their medical issues. In the article Computed Tomography CT written by the FDA.org, it states tomography is a non-invasive medical examination or procedure that uses specialized X-ray equipment to produce cross-sectional images of the body. Each cross-sectional image represents a slice of a person being imaged. Like a slice of a loaf of bread, these cross-sectional images are used for a variety of diagnostic and therapeutic purposes. CT scans can provide detailed information and diagnose, plan treatment for, and evaluate many conditions in adults and children. Additionally, the detailed image provided by CT scans may limit the use of explorating surgery. Although there are many benefits to CT scans, there are also some risks that go along with them as well. If you think you're going to be pregnant or you might be pregnant, in most cases you are not allowed to get a CT scan. In rare cases, if your doctor believes that you need a CT scan due to showing signs of symptoms or a need for possible treatment during pregnancy, you're allowed to get a CT scan. If you do end up getting the scan, you could lead to putting your baby's health at risk. In the article, CT Safety During Pregnancy, it goes on to explain the reasoning on why having CT scans is usually not allowed during pregnancy. For the abdomen or pelvis, it is not if the abdomen or pelvis is not being imaged such in chest or head during pregnancy, it goes on to explain the reasoning. If the abdomen or pelvis is not being imaged, such as chest or head CT, there is no risk to the baby from radiation. The amount of radiation used in a normal CT image has never been shown to cause harm or harm to an unborn child. However, if the CT scan examines the abdomen or pelvis area, there may be a slight high risk for the baby. An unborn baby exposed to CT during pregnancy may have about 1 in 1,000 greater chance of developing cancer as a child. The level of risk is not proven, though it may be non-existent. A radiologist and a CT technologist will adjust the CT examination techniques to lower the radiation dose to your baby if they know you are pregnant. If anyone that is involved during the procedure, including the radiologist, technicians, and the patients are made aware of the risks, CT imaging is such a beneficial and helpful way to diagnose health problems. The article CT Patient Safety states, CT imaging is currently at the forefront of diagnostic imaging, is providing accurate and timely information for medical and surgical intervention. Due to the wide applicability of diagnostic imaging, a thorough understanding of radiation risks associated with CT scanning is essential for every healthcare provider. Contrast material is widely used in CT scanning in current medical practices. Understanding the appropriate application, usage, and risks of contrast material is essential to prevent adverse reactions and outcomes in the contemporary patient population. Results. In years to come, CT imaging is expected to only further grow. In the article, Recent and Future Direction of CT Imaging, written by Nurab J. Pelk, it goes on to say, to any individual patient, the benefits of CT outweighs the risk, but the concern over population dose has caused dose reduction to become an important technology driver. CT technology development in the coming decade can be expected to be driven by the same forces that have driven the development of CT since its inception: image quality, speed, new and improved applications, and dose reduction. And then these are my references.